So the Democratic Alliance in Gauteng says the loss of 4,000 staff appointed to assist during the COVID-19 pandemic will hit the province's hospitals hard. The Gauteng Health Department received a 2.2 billion rand to appoint staff on a temporary basis. That was for a year in 2020. These contracts were then extended to the end of March this year, but around half of the contracts will not be extended any further. To discuss this is Democratic Alliance's Gauteng MPL Jack Bloom, who joins me now. Good afternoon, Mr. Bloom. Thank you very much for your time. Now, you've added your voice to those concerned about the impact that the departure of the temporary hospital staff will have on the healthcare. Just talk to me about your position.
Well, our hospitals are under stress even without COVID. Now, I know these were supposed to be temporary posts to assist with the COVID epidemic, and we were hopeful that the epidemic is lagging, but it could start up at any time. But the reality is that even without the epidemic, our hospitals are enormously understaffed, and that's a good reason to keep on the full 8,000. I really think that there's a cry for help from our hospitals. We saw it yesterday, Chris Hani Baragwanath Hospital, when they had a demonstration. It can't go on like this. We can't have all these staff shortages and mismanagement and corruption in the Gauteng Health Department, and to lose so many staff members at this particular time, I think is going to be devastating. The remaining staff are going to be under much more pressure. Patients are going to suffer because of this. And meanwhile, we end up paying for Cuban foreign doctors. We've still got Cuban foreign doctors working in the Gauteng Health Department. So we must get our priorities right. Hospitals can't operate without staff. It's a people-intensive business, and they're not, the best will in the world. Doctors work long hours, nurses work long hours. You need auxiliary workers like cleaners, porters, and clerks. And if you understaff a hospital, unfortunately, medical negligence is going to go up. And as we know, it's sky high.
Yeah, actually, that is the truth. But now, that argument of misplaced priorities, it could be valid. But if we go back to the real issue here, it's financial. We spoke of a 2.2 billion grant that they received. If they don't have the grant, would they not legitimately then be able to say that we cannot retain all? At the very least, we can retain half, even though they do concede that they are chronically understaffed?
Well, I think it was meant to be as a temporary grant to cope with the epidemic. But the Gauteng Health Department budget was tabled this week, and in fact, there's no increase whatsoever. I'm just gobsmacked, quite frankly. No increase whatsoever in the Gauteng Health budget. Now, you could argue that the existing budget should be sufficient. It's 59 billion rand, which is an enormous amount of money. You can run the city of Cape Town on that budget, and that's true because there's massive mismanagement, fraud, corruption. I've estimated that there's at least 2 billion rand that's been wasted in the last 2 years because of corruption. But they need to put their house in order. But in the short term, I think the department needs a rescue fund, a rescue plan, and an extra burst of funds. So I'll tell you why. They're currently owing more than 40,000 suppliers 3 billion rand. And that's why we've got the shortages of food and all sorts of other suppliers at Chris Hani Baragwanath Hospital and other hospitals in Gauteng as well. So unfortunately, there's suppliers that are owed huge amounts of money. I think there does need to be a short-term bailout, but with strict conditions. The strict conditions should be fix up the department once and for all so that you can provide decent services within the existing budget.
Now, speaking of food, they've gone on to clarify that the food issue was merely confined to bread, and it's because they hadn't paid their suppliers, just as you mentioned also there. So is it really the way to approach it, the way they went on to say that it's not in fact a crisis? Here we just have patients who prefer bread. If you didn't have bread in a hospital, it's neither here nor there per se. What did you make of that statement?
Well, I think that's very arrogant. Bread is a staple, and obviously it should always be served at a hospital. In fact, I've just found out that there are other hospitals in Gauteng which also have bread shortages. But I think let's be honest here. The only reason that the department reacted because there was bad publicity, that doctors were buying patients' bread with their own money, that charity organisations were stepping in. I think this is unfortunately happening at other hospitals around the province as well. The department should have picked up this problem long ago. Now we hear that the shortages of bread started in mid-February. Well, why weren't alarm bells ringing then? Look, it really boils down to the fact that this department has been comprehensively mismanaged for a very long time. When Premier David Makura became Premier 8 years ago, he promised a, quote, urgent turnaround of the department. Now that hasn't happened. And I think it's high time that we put the right people in the right jobs, cut out the corruption, and make sure that it's properly budgeted for, that we can get the staff that we need. So it is a puzzle that the Gauteng Health budget has received no increase whatsoever. I'm not sure what can be done at this stage. They will probably need to have a bailout, an adjustment budget, because we can't go on as we are with all the enormous problems in our state hospitals.
Yet they say it's not a crisis. Mr. Bloom, thank you very much for your time. That's DA's Gauteng MPL Jack Bloom.